You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome to Let's Talk Business. My name is Kelly Bolton, and I thank you for tuning in as we have the distinct pleasure of hosting our community's foremost leaders and entrepreneurs. Today, we're honored to have with us Linda Habashi. She's a volunteer coordinator of Baptist Trinity Home Care and Hospice. Baptist Trinity provides skilled professionals for quality home care and hospice to patients in the Memphis community. In addition to physician and nursing professionals, they provide counselors, chaplains, and educational offerings to the patients as well as the families. More and more Americans want to age in their own home, and Baptist Trinity fills the important and growing need. So without further ado, let's talk business. Thank you so much for joining us. I know personally, I've had experience with Baptist Hospice, and it came at the perfect time for my family. And, you know, I think most people probably that are viewing have heard of hospice, and many people have had some type of experience with it. But maybe before we get started, can you explain what is hospice?
That's a wonderful question, Kelly. And hospice is a benefit that we're all entitled to. It was written into the Medicare program, and hospice is really, the benefit is typical. Typically, people are referred to hospice by their PCP or a physician, maybe a cancer doctor or any other kind of physician. And they usually refer the patient to hospice when they have 6 months or less to live. There is a diagnosis there. So oftentimes those patients, though terminal, come to us and are so thankful to have us. We can help the patient and the families in many ways.
It's a wonderful thing to have at a very difficult time. And I can speak personally to your facility at actually Baptist in Collierville.
Oh, yes.
It was, you know, the unfortunate diagnosis that no one wants to get, and it was just a few years ago. And the situation with my family member was my father, and unfortunately his condition, and he was a larger man, was where we could not care for him in the home.
Yes.
And without round-the-clock care, and we just physically couldn't do it.
Yes.
And it gave us the ability to love him and to grieve with other people providing all the extra stuff. So
Yes.
we got to just have those last moments and time together, and in a very it's difficult to say. Anybody that's been through it, anybody that's been through it can say that it was actually some of the best of times and the worst of times all together. But without the assistance of Baptist Hospice, we would have been the worker bees and exhausted and not able to share those last moments. So
that's what hospice is for. Hospice is there to provide nursing care, support, comfort in those last days. It's there to improve the end of life for our families. And that's what it's all about.
Well, I can tell you, having been there, I can tell you that I have raved on the experience in one of the most difficult times. But you know, the one thing that really struck me when I was there is the workers. You know, they appropriately had smiles and happy, upbeat attitudes, but in a very loving sort of way. I mean, even from the brushing of the hair to the bathing to the to providing meals. And really, I felt as though my family was as much of a patient as my father was. And I thought, how are they doing this?
See, that's what's so special. That's what's so special about hospice.
Yes.
Hospice is there to care for the families as much as the patients.
And that is the thing
key.
I noticed. Yeah. So how do they deal with that? How do they come to work every day and deal with such a difficult thing and then go home? Because they showed up every day with a smile on their face and a willingness to do whatever it took.
Well, I truly believe that our hospice nurses, our CNAs, the people that work at the hospice house especially, it is a calling. Yes, it's a profession they're paid to do this, they want to be there. And that's the difference. You are, people think hospice is just so sad and depressing. It is not. It is living until the end. It's not, you know, what people think. I think there is a misconception there.
I can tell you that what you just said was 100% my experience. Just from the beauty of the facility when you came in with, you know, the wonderful person that greeted you and the big living room with the fireplace and who makes the soup and puts out the sandwiches. I mean, and it's funny because every day we never had to worry about a meal because food was provided for the family.
Yes, we have a wonderful donor who does
sandwiches.
that.
So you have a volunteer kind of donor.
We have a donor who provides the soup, the sandwiches, the tea, the coffee every day, 7 days a week. I think it's around between noon and 7 o'clock at night at the hospice house. That is not a volunteer, but volunteers are the ones who greet you as you walk in the door.
That's interesting.
They're the faces that make such a difference, and they're the ones who visit the patients. They're the ones who do some gardening, or maybe we have a veteran and they visit the veterans. You know, we have a thriving veteran volunteer program. We have pet therapy. So
I saw somebody playing musical instruments.
We have harpists who come on Friday mornings and play harp for the families and the patients. And it's so soothing, and it just completes the overall relaxing, sweet picture that is our hospice house out there in Collierville.
So. It really, it's very interesting. So if somebody wanted to volunteer, and I know it's got to be a calling, and I love how you said it. Say that again about when you said it's about living until the end. It's about
living until you die. It's not about dying. It's about living to the fullest, living life to the fullest.
That's a wonderful, wonderful way to put it. And if somebody wanted to volunteer, how do they do it? Because I know there's also a little facility connected to it that is part of the grieving center.
That's the grief center. That's the Baptist Grief Center. And that is for patients or community, people in the community who are dealing with the loss in their life. So that is a separate thing. If you want to be a volunteer, though, I'm the volunteer coordinator. You would go to me. Call up to Baptist Hospice at 767-6767.
Okay.
Ask for Linda. That's me. And we'll talk about the details around volunteering. We're always looking for a wonderful volunteer to sit at the front desk, to be that smiling face, to brighten the lives of the families and the patients.
Oh, that's wonderful. And let me ask you this before we take a break.
Sure.
Is there any training that is involved to do this?
To be a volunteer, we do have a training. And we're very careful because we want to be. We want the best, the sweetest people, the people who understand what an important time in the family's life and the patient's life that they'll be around. So we have a training. We do background checks. We do drug screens. We talk about hospice and all the details around hospice.
Well, that's wonderful.
Just kind of prepare everybody for what being a volunteer is, and it's a wonderful thing.
Well, that's wonderful.
Yeah.
Thank you so much for sharing that with us.
Sure.
We have to take a short break now, but when we return, we'll continue our discussion, so please stay with us.
We have 4 major vocal ensembles at Germantown High School. There's a large chorale with about 50 to 60 students, a women's chorus, our chamber choir, which is an elite ensemble of 18 singers, and a contemporary a cappella group, which is about 16 singers.
It's really nice to be in a room full of people who share your passion and who want to learn and make every song as beautiful as it possibly can be.
I really try to instill in my students the importance of connecting with the literature, that they have to go outside of the box and actually understand what they're singing about.
Thank you.
This program has really pushed me. It's shown me a lot of my insecurities and how to grow past those.
Many times we'll gather around the piano, to build that sense of camaraderie, to be able to hear each other better, to interact with each other and make music together.
Work together, hold that solid.
Then we genuinely love music. We sing because we want to and not because our Mr. Hayner is telling us.
Do 2 beats, you come in. 1 and 2.
Music empowers us to come together as a group. I feel like this generation has become so focused on me, 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 me. And music is us, 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 us.
For more information about the Kappa program, visit ghskappa.com or call 755-7775.
We see the potential in every single student.
That sounds like a confession to me.
I love watching these kids as they start as freshmen in high school and watching them mature and grow. It really is something special that is really what I love about my job.
At last, my right arm is complete again!
The theater program at GHS, it's something special.
It's very intensive, it's very interactive. When a student starts here their freshman year, they start with Introduction to Theater. And after that year, they have a choice to either go into acting or technical theater. And then after that, they join our production workshop class. It's the class that is completely run by students.
The students do mostly everything. We build the sets, we do lighting, we make the costumes, we do the shows.
It's very fun. I mean, everybody's very supportive of each other.
Now we're all in this together.
It's taught me so much about how to act and how to have a stage presence.
Not only are we teaching the students the skills that they need to be a great performer or a great stage manager or a wonderful lighting designer, we're teaching them skills that they're going to be able to apply to whatever they do in their life.
You guys are fabulous!
This department not only makes wonderful theater, but more importantly, this department makes wonderful people.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Let's Talk Business. If you're just tuning in, I am Kelly Bolton, and today we're going to be talking with Lisa Johnson. She's a hospice patient care manager of Baptist Trinity Home Care and Hospice. And we're going to learn more about the many services they provide their patients and the community. So, Lisa, thank you for joining us. We certainly enjoyed visiting with Linda on the first segment of our show. And I know we got into a lot about volunteers and what volunteers can do at hospice. And I shared with our audience and Linda about my experience. And I thought maybe we could step back for a minute and talk a little bit about the kind of patients that need hospice. Because she mentioned to be able to use hospice, you have to have a diagnosis of 6 months or less to live, which nobody wants that diagnosis. But how sick do you have to be to get hospice? I mean, what are the criteria?
So with hospice care, like I think Linda mentioned, it's a benefit that we all get, whether we're Medicare patients or private pay insurance companies. You need a hospice diagnosis, and there are certain, it can be heart disease, lung disease, cancer, liver disease, and what it does have to be where your physician has deemed he expects 6 months or less to live. That said, some of our patients live much longer than 6 months. And so we walk that journey with them, whether it's a couple of weeks or 9, 10 months, maybe even a year. But the physician does have to send a referral saying, this is what I expect, and then we send a nurse to the home to meet with the patient and their family to discuss our services, what hospice is, and see if they want to sign on and be part of our services.
And then they have a choice about home hospice or going to your hospice facility, or do you make that decision for them?
The family has a choice.
Okay.
I know you're talking about your experience at the hospice house. A lot of our patients, some of them start at home and then transition to the hospice house later. Some of our families stay home the whole time. With a patient at home, we have nurses come in a couple times a week. The nurse comes in, checks the patient, makes sure they're comfortable, make sure they have medications they need. We offer CNA services to help with bathing and linen changes on the bed.
And that twice a week?
Up to 3 times a week for
Okay.
either one. Our volunteers, Linda can arrange a volunteer so the family can go to their doctor's appointments or grocery store or whatever they need to do. We have
that's nice. A volunteer will go to the home.
They will
Wow.
go sit with the home with the patient. So
how wonderful.
the family member can
You forget about
run
those
those errands
things that you have to do, but you feel like you can't because you can't leave someone.
Yeah, because you don't want to leave your loved one. So Linda can pair up a volunteer to come sit with them so you can go do those things that we all have to do. We have a chaplain, we have a social worker. They come in, they are just spiritual support. Social workers pull in other services, other agencies that can maybe help and provide services.
Really? That's very, very nice. Well, and you mentioned your doctor.
Yes.
Obviously, if you have a diagnosis of 6 months or less to live, and my understanding is when you go on hospice that a lot of they're trying to give you quality of life, and at that point not necessarily trying to do everything they can heroically to extend life. But would you still see your doctor?
So you can. With hospice care, you're referred to hospice for a certain diagnosis. Like I said, heart disease, cancer, lung disease. That said, you can still go see your primary care doctor. You can still go see, if we have you, let's say, admitted for cancer, you could still go see your heart doctor. Whatever your hospice diagnosis is, that is what we're taking care of. So if you were admitted for cancer, usually your cancer doctor turns care over to our medical director, and she takes over that care for you. But you could still go see your primary care if you have a cold or a urinary tract infection or something like that. You can still go see those doctors.
That's good. I think a lot of people have the misconception that if you accept hospice in your home, that means you stop caring for yourself altogether.
Right.
But you can still go, like you said, if you have a cold, you're just not necessarily treating the disease that has caused you to get to the point where you need hospice.
Right, exactly.
And that makes a lot of sense. And is it expensive? And who pays for it?
So hospice care is covered for our Medicare patients. It's covered completely by Medicare. Home hospice is, and also with private insurances. The nurses come in, the CNAs come in, chaplain, social workers.
So it's 100% covered?
It's 100% covered. Medications we provide, any equipment we provide, if you need a walker or wheelchair or anything like that, we provide. Medicare and insurance cover that. If the family chooses to go to the hospice house, there is a room and board fee there that is not covered by insurances, and the hospice house would talk to the family about that and let them know what payment options are available for that.
And are there any opportunities if somebody needs hospice house and is not in a position to pay for it? Is there any funding that's available?
There is a grant through the Baptist Foundation that we are partnered with, and they do a financial evaluation. And the social worker at the hospice house would go over that with the family and make sure that we want to make sure those funds are used appropriately. So they would review that with the family and see if they meet for criteria, and then they would contact the family and say, we can offer you this much of a discount, and the family can decide from
That
there.
makes sense. And then we talked with Linda about volunteer training, but I was wondering about the training for the nurses, because I'm obviously not a trained nurse, but nurses go to school to help take care of you. So, and a lot of their training is, caring for disease and treating and that sort of thing. But now you're treating something different, and we're going to have to take a break here in just a minute. But for my last question, how do you train those nurses? Because that's kind of a different type of thing that they're doing versus what they might be doing traditionally.
It is. It's a different type of nursing. We pair, if you will, our new nurses to hospice with a experienced hospice nurse, and they spend about 6 to 8 weeks together learning hospice, learning how to make sure those patients are comfortable, their symptoms are managed. We offer yearly training. There is education they can do all through the year that we make available for them so they can stay up to date and learn how to take care of these patients in those final months
That's wonderful, and I'm assuming you do it for your chaplains, your nurses, your
social
volunteers,
workers, yes,
special training.
Yes,
Well,
ma'am.
that's just wonderful. We're so blessed to have you in our community. We really are. Thank you very much. It's time for our next break, but when we return, we will finish our informative discussion, so please stay with us.
Art is really an expression of the self. If you look at a piece of art, you can see the artist within it.
All just really depends on what I feel like doing at the time. I generally have different ideas every day.
I really get excited when my students come up to me with unique ideas that I've not heard of.
You can't let everybody tell you who you are or what your art is or how to be what you want to be.
I really let the students go according to how they're progressing, and I try to give them as much as they're able to handle.
Well, I like drawing a lot, and I like painting, and I like being able to improve my skill and show people my art.
I try to get them to think creatively. I think that's one of the few things that we as teachers really need to try to push with our students.
I can't sing. I can't act either, but I can do art, so that's why I chose art.
For more information about the Kappa program, visit GHS-Kappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Thank you for joining us on Let's Talk Business. Today we're honored to have Brooke Shepard, who's Hospice Account Executive Director of Business Trinity Home Care and Hospice. With just a little time left, we want to jump back in and finish our conversation with Brooke about their informative commitment to the quality care and family support. And Brooke, I may have misstated your title because I know you're the third one I've had on, and there's one of you that's
Sure.
actually not on the show with us today.
Sure.
But can you explain what is your title so I don't
Sure,
mess
I'm
it
an
up for
account
everyone?
executive,
Okay.
so that's the marketing for Baptist.
Right,
Trinity Hospice.
what your role is to make sure that the community knows about Baptist Hospice.
Correct.
I guess.
Correct.
Well, that's great, and I will tell you, until you have been in that position to need to know, a lot of times you just don't know.
Absolutely.
And then when you're in the position of needing to know, it's at that moment when you're like, I have to make this decision immediately.
Absolutely.
So I guess your role is to go out and inform doctors, nurses, all that sort of thing about Baptist Hospice and how they work in the community?
Correct.
Is that it? Well,
Correct.
good.
So what I do is I'm in the physicians' offices, the assisted living communities, community events, educating both that staff as well as sometimes the patients or residents themselves, so that they can make an informed decision.
That makes sense.
It's tough.
Yeah, it is I'm sure it's a very difficult thing because nobody really wants to talk about it.
No,
I
they
mean,
don't.
like this show is not the show that we talk about being an exciting show. It's just, they say that, there's a few things, certain in life, and one is death and one is taxes. And I deal with taxes all the time, and, in my line of business, I deal with death too, and it's unfortunate, but I think, sometimes if we think about those things prior to them actually happening to us, what our wishes are, it makes it a little bit, easier on the family. If you were telling, because we are on the show,
Sure.
we're kind of informing audiences. I mean, obviously, everyone wants to get up every day and plan on living. That's what we're doing. We're here and we're living, and we're going to live life to the fullest, to the very end. But is there anything that we should know as individuals, as families, as we face these moments in time that that way when we get there, we're not so uninformed?
Sure. I think the misconception most often is that everyone thinks we're giving up on them. And then it's you had said
Yes.
this earlier, that we're not going to take care of ourselves, we're just going to give up and move on. And it's so not the case. In fact, so often people will live longer because that quality of life is back. They have the energy sometimes to do things, and more importantly, the families are taken care of. I recently dealt with this experience with a family member, a very close family member, and the first thing the caregiver said was, I had no idea that I would be taken care of too, and that hospice would take so much off my plate and allow me to to function, you know, and be able to spend time with my loved one.
I have another question for you. Let's talk about when you choose one versus the other, home care or at, say, Baptist Hospice House. Once you've chosen one, is it a permanent decision, or can you change your mind and go back home or go on into
You absolutely can.
Good.
It is, you know, and once you're in hospice, you're not committed 100%. If you decide, you know, you need a minute to rethink it, you can absolutely graduate or come off hospice.
Well, that makes sense. And you know, I think one thing that people feel like as families, or even as the patient, once they go to hospice, they've made that decision to give up. You know, the family member thinks I've given up on them. The patient thinks I've given up. And then when you make a decision to go to a hospice house, you feel like you've failed them somehow because I can't care for you. So can you speak to that and kind of, I'm not going to have a ton of time, but if you could just kind of answer that briefly?
Sure. You know, I always say we're never giving up. Not ever are we giving up. We're just symptom managing and making everyone comfortable. That's the family, that's the patient. And I think with the hospice house, sometimes it just requires a little more based on that diagnosis or the stage of this journey that we're all going to go through at some point. And that just requires sometimes a little bit more than what we can get at home.
Well, and that makes sense. I'll tell you, this has really been a very great discussion. I've enjoyed meeting you and Lisa and Linda, and it's not anything we want to talk about. It's not going to ever be considered our most exciting show because it's not meant to be, but it is part of life, and it's the journey we take, and we thank you all for what you're doing in our community, and we thank you for being our guest.
Thank you so much.
Once again, I want to thank all of our guests from Baptist Trinity Home Care and Hospice for joining us today. For more information on our show, you can check us out on the web at GHS-TV.org, where we're streaming live 24 hours a day. You can also check us out on Facebook and Twitter. We hope you will join us again next month on Let's Talk Business.